as it was said, I am a Liverpool School of Tropical Medicine recent graduate, and I'm going to present my dissertation research project that it was done under supervision of my co-author, Justin Fulford. So as a humanitarian, I have worked as a field level implementer carrying out humanitarian activities. In my work, it was not always clear how this impact was being monitored or evaluated, and in which ways we were accountable to the populations that we were serving. In addition, I wasn't really sure how we learned from this information to improve our work. Monitoring, evaluation, accountability, and learning is what is referred to in the sector as MEAL, and it is important metrics that are used for performance assessment. The humanitarian imperative to save lives, alleviate suffering, and maintain human dignity is the ultimate goal of all humanitarians. Humanitarian performance is described as the activities towards the imperative, which are well managed, relevant, accountable, impartial, durable, and of good quality. A lack of MEAL threatens humanitarianism and leaves uncertain impact towards the imperative. Without MEAL, organizations are at risk of causing unintended consequences and possibly harm. Targets for humanitarian performance are outlined by key networks such as the Core Humanitarian Standard, or CHS, which set out 9 commitments for standards in equality and accountability. SPHERE sets out standards in technical areas for humanitarian action, and the process and strategies in which to achieve these standards, implement MEAL, improve activities are further supported by the guidance, research, and compiled evidence from ALMAP. These 3 networks identify MEAL as essential to achieving the imperative and meeting standards for humanitarian action. This study was inspired by my interest of the relationship between MEAL network standards and their use of measuring humanitarian performance. A literature review revealed some core issues related to this relationship. There is some limited practicality with standards, as their prescriptive thresholds and boundaries may not be compatible with the complex nature of humanitarianism. Membership to these networks is voluntary, and there is no regulation within the sector. Overall, there's approximately over 2,000 humanitarian organizations globally, and a very small number of them are actually membered to one of these networks. The impact of networks and their standards on humanitarian performance has also not been formally assessed. On the website of the CHS, where they have scored their members on how they've achieved these commitments, not one of their standards has achieved the fulfillment threshold. Some organizations are reliant on institutional donors, which often results in substantial upward accountability as opposed to downward accountability towards the affected populations. And although many humanitarian organizations agree that strategies are needed to address quality and accountability within the sector, networks continue to face strong opposition to their work. High turnover, burnout, and insufficient skill sets of managers affect humanitarian performance. So this study aims to identify the attitudes towards the realities of MEAL implementation and support for more practical standards and MEAL guidance. The objectives were set out to explore humanitarian workers and network representatives' understanding of, attitudes towards, and perceived value of MEAL and standards in practice, their perceived motivating factors, deterrents, and benefits related to MEAL, as well as the adoption and adherence to standards, and the perceived supports and limitations to the implementation of MEAL and standards. I conducted a prospective qualitative study. A total of 52 organizations met inclusion criteria and were contacted to participate. From those, a total of 18 participants were recruited, representing 7 organizations and the 3 networks of CHS, SPHERE, and ALMAP. The data was collected through semi-structured interviews, which were administered remotely. The sample included 6 MEAL advisors whose role it is to guide, support, and direct organizational MEAL practices, 8 humanitarian implementers who are typically at the field level implementing and organizing programs, and 4 key informants from CHS, SPHERE, and ALMAP. Ethics approval was obtained from the Liverpool School of Tropical Medicine. General inductive approach for thematic analysis was used and revealed several key themes. Overall, the participants perceived that meal was an essential tool for humanitarian work and management. However, their positive attitude towards meal was not always reflected in their actual understanding of the concepts. Monitoring and evaluation was seen as more practical and understandable, whereas accountability and learning was seen as more difficult, and they described it as not easy, fluffy, fuzzy, or tricky. The humanitarian imperative was identified as the main motivator for all participants, and they felt that it should take precedent over all other operational needs, including performance improvement. Time, cost, and human resources were also identified as key contributors to abandoning meal and standards. Participants identified the donors as major influence for adoption of implementation of standards in meal. Participants from more financially independent organizations described the luxury of being able to design and implement their programs without the oversight of external agencies or the pressures to adhere to external standards. However, these same participants also admitted that their organizations lacked meal altogether or even prioritization of improvement. Advisors and network representatives had unquestionable expectations that meal was the responsibility of implementers. But these field level implementers did not understand these concepts, were confused about their role, and also about the role of their advisors. Humanitarians identified the lacking skill and training as a major issue to the overall humanitarian management, including meal. Meal advisors felt that the work involved to maintain and adhere to network standards, topped by the high number of association membership costs, was discordant with the benefits that they actually received in return. Key informants from these networks acknowledged that their appeal of their bonuses were diminished in some way when all of their resources and standards were available as publicly available goods. The impact of these networks are unknown and were assumed based on immeasurable metrics such as changes in mindset or name recognition. The humanitarian principle of independence is a massive force which is preventing or being used by organizations to avoid commitment to external standards. The rejection of standards reflect a culture of egoism and is to protect the organizational good. The good of these organizations is marked by their actions and steadfast dedication to the humanitarian imperative. Yet, the actions and efforts towards the imperative cannot be measured as meal and standards have been abandoned, and individual humanitarians must rely on their good intentions as assumed positive impact for their efforts. Good intentions are not measurable, and continued apathy towards meal and standards will mean that humanitarianism is vulnerable to scrutiny and will result in unintended consequence. Organizations who commit to standards have more recognizable meal tools in place, and they have assigned meal advisors. However, the insufficient skill sets of advisors themselves and humanitarians severely limits the use of performance tools for their full and intended purpose. CHS, SPHERE, and ALNAP offer strong guidance and targets for humanitarian action, yet in their current state are unlikely to attract new membership or inspire stronger commitment. The misconstrued influence of the network output suggests that these networks haven't actually evaluated their own performance. And without major surprise, there remains a resounding deficiency in accountability and learning of humanitarians and their organizations. My recommendations include that networks need to promote standards and guidance, specifically targeting field level workers. To address the egoism and attitudes of organizations, this will remain a major challenge. However, the power of the public, field level implementers, private and institutional donors should be considered as a catalyst to promote the utilization of performance enhancement tools. Networks need to assess the impact of these initiatives and can no longer assume their influences. Organizations are unlikely to compromise resources towards their imperative in favor of ineffective, weak, costly, or impractical network memberships and resources. Humanitarian organizations must prioritize meal by incorporating it along all lines of the humanitarian program cycle. They also need to clearly define staff responsibilities and ensure resources and supports, including meal advisors, are available. Field level implementers should be involved in the design process of programs and to identify the associated performance targets that they are meant to achieve. And finally, education institutions who offer humanitarian or global health studies must have a responsibility to center quality and accountability towards affected populations in their teachings. and they must engage students in in-depth discussions about their own positionality with this subject. Humanitarian NGOs must specify the required competencies, training, and experiences expected of their candidates and provide continual learning and development of staff. Organizational prioritization of meal is essential to improve performance, but it will need agreed sector-wide targets to ensure that organizations are accountable. The CHS, ALNAP, and SPHERE offer a trifecta of significant guiding resources to improve quality in humanitarian action, yet have work to do internally to strengthen their impact and membership structures. It is time to move beyond the assumed benefits of the altruistic good intentions and for the humanitarian imperative, and to improve professional humanitarianism with meal and stronger advising network standards. Thank you.